there is two type of pemphigoid. There is your pemphigus vulgaris, and then there's a bullous pemphigoid. These are two dermatological autoimmune conditions that you see. Both will present with bullae or detachment of the skin, basically. Now, how do you differentiate between your pemphigus vulgaris and your bullous pemphigoid? I'll explain the clinical aspect of it, but because we're talking patho first, I discuss that one. Okay. Now, here's your epidermis, right? And these are all your keratinocytes or your epithelial cells here. Okay. There are 5 to 6 layers of your cells. And now these cells are connected to each other and with the basement membrane, right? So there are connections in between these cells. So there are connections between the cells and then the cells and the basement membrane. So when it comes to your pemphigus vulgaris, there are antibodies that are targeted against these intercellular junctions, which are made up of your desmosomes. And then in case of bullous pemphigoid, there are antibodies against these junctions, which are connecting your epithelial cells to the basement membrane. And these particular connections are called your hemidesmosomes. Now, in this condition, this patient is having an epidermal biopsy that shows epidermal basement membrane with IgG antibodies and linear immunofluorescence, which means these connections, these hemidesmosomes, have developed antibodies against them. The antibodies are stuck to these channels here, these connections here. So there will be a linear immunofluorescence. What is immunofluorescence? You tag the particular antibody and then you give it a fluorescent light and see which part shines. So if an antibody has stuck up to these hemidesmosomes, there will be a line shining, in your basement, along your basement membrane, you'll see a shining line. It will show a linear pattern, and that is seen in your bullous pemphigoid. Unlike if in case of your pemphigus, these intercellular junctions are involved. Now these junctions are then randomly spread between your cells. I'm not drawing the cells again, but you'll see a reticular pattern of immunofluorescence. I'll show you the image in our FA also, so that is clear. So this is a reticular pattern. This is a net-like pattern that you see of immunofluorescence. That means the antibodies are diffusely spread in between the cells. That is, the intercellular desmosomes are affected. Thus is seen in a pemphigus vulgaris. Whereas here you see a linear pattern of fluorescence because the hemidesmosomes along the basement membrane have been affected, and that is seen in your bullous pemphigoid. So both of them can present with a vesicular rash. In bullous pemphigoid, you will see tense bulla formation. In pemphigus vulgaris, you will mostly see sloughing off of your epidermis. There can be vesicles present. There is no such surety as to it. Pemphigus is seen usually in patients who are less than 50 years of age. Bullous pemphigoid is something to suspect when the patient is more than 50 years of age. Also, there is one stark characteristic, that is, in case of your pemphigus vulgaris, there will be involvement of your mucosa, whereas in bullous, there will be sparing of your mucosa, right? Yeah, so these are flaccid blisters. You can call these tense blisters. I think we have covered most of it. There's reticular, and yeah, I guess we're good to go. Okay. So these are both classified as your type 2 hypersensitivity reaction. That is something you need to remember. And treatment would be obviously your steroids.
Thanks for watching. Please give a thumbs up and subscribe for more.